welcome to Health Talk. My name is Janet Trang, and today we will be talking about the treatment of advanced abdomen cancer. And with us, we have Dr. Augusto Bastidas. He was trained at Johns Hopkins University, a former faculty at Stanford University, and professor at Loma Linda University, and he's currently in private practice. And we have the honor of having Mr. David Habash with us, who was a patient and also had the treatment that we would be talking about today. Thank you for joining us today. So Dr. Bastidas, what are some of the abdomen cancers that are out there right now?
Well, thank you for having us today. First, I want to thank Mr. Habash for joining us. I'm sure it's very difficult as a patient to get on TV and talk about living with cancer. Today we're going to talk about a very select situation of patients with abdominal cancers who have had tumors spread to the surface of the peritoneal cavity. So you have the abdominal cavity, you have all the organs inside, and you can think of the peritoneum as a bag that contains all these organs. And so that bag, the surface of the bag, is what we call the peritoneum. And today we're going to be talking specifically about patients who have tumors of a whole different variety that have spread only to the surface of the abdominal cavity or the peritoneum. Those tumors include gastrointestinal tumors, ovarian cancers, and some rare sarcomas and mesotheliomas. But before I get going on the medical part, maybe Mr. Habash can tell us a little bit about his story.
Hello, David.
Hi, thank you for having me here today. In 2008, I start feeling like I'm gaining weight. My pants getting tight. So I called my doctor, Dr. Shamali in Daly City, California, made an appointment with him. I did a blood test, which he requested, and a week later when I saw him, and he told me that he had bad news for me, and he mentioned that I have cirrhosis to the liver, hepatitis C, and hepatitis B. So I mentioned to him that I don't drink, I don't do drugs, sex only with my wife, and never have a blood transfusion.
And so those are the risk factors for hepatitis.
For hepatitis. So I asked him if I could see a specialist. So he referred me to Dr. Tisiosi at Seton Medical Hospital in Daly City. He looked at the blood test. He said, this is the wrong one. He sent me to Seton Hospital to make a new blood test. I went back to him after that, and the result was he have good news and he have bad news. The good news is my liver is okay. The bad news, I have a tumor which is leaning over my liver. My liver looked like it kind of collapsed. So he ordered a room with the sonogram, or ultrasound, I mean, and took my clothes off. He played with my stomach, which used to wear size 32 pants, and that time I was wearing 48 pants size. So he got to the tumor head, and he inserted like an amniocentesis needle inside, and he drained some fluid, which he took to the lab to test it. Then he ordered the nurse to drain that fluid out. So she drained about 4.5, 5 liters. My stomach went down. I felt a lot better. Then he told me it was a tumor, and I need to do chemo. He referred me to oncologists in San Francisco, and they said 5-6 sessions of chemo. I have 2 cousins, one of them named Dr. Khalil Msais. He's in New Orleans, Louisiana, which I was talking with him about it, and he mentioned that a surgery will be a lot better and more safer. So we start looking, we find about Dr. Sugar Baker in New Orleans.
And then he's the pioneer of...
He's the, yeah, of that kind of operation. And I think I have to wait about 2-3 months, and it's a big risk. So I have a sister, she have a deli by Stanford University, which Dr. George Triadopoulos, one of her customers. So she asked him, he said he's special in stomach thing, you know, he's a doctor in the stomach specialty. So I went to see him. He told me there was a doctor in Stanford, he do that operation. 3-4 days later, he said that doctor moved. So I felt a lot bad. We went back to Sugar Baker things. Then second day, he called me. He said, David, I was in the elevator, and there is a Dr. Shilali.
Single.
Oh, yeah. So she went to see you. So I went to see her. Then she referred me, to thanks God, to Dr. Bastidas. I saw him on a Tuesday. Then the week after, he decided to have the operation. I thought about it's going to be about 2-3 hours. Everybody's talking about operation for an hour or two. So when I went in, I crossed my face. I didn't wake up till 13 hours later. It was my wife was worried. My sisters. Thanks to Dr. Bastidas, he came out and he told my wife, "Don't worry, he's going to be okay." But everybody was worried. You know, it's a long operation.
So what, Dr. Bastidas, what treatment did David have? What was the surgery?
So first of all, let me go back and have him describe a little more of his initial symptoms. As he mentioned, his belly got bigger and bigger, and his belly got full of fluid called ascites. And the disease that Mr. Abash ended up having is referred to as pseudomyxoma peritonei. And it's a rare tumor that starts in the appendix. And this tumor spreads to the peritoneal surfaces and secretes fluid and sometimes mucin, like a jelly that's in the belly. And some people call it jelly belly. It's and the treatment for this disease is a very big operation where you strip out all the surface of the peritoneum. This disease, unfortunately, is not very sensitive to traditional chemo, and so surgery plays a big role in this treatment, even though it's a fairly advanced cancer. Many other cancers, once they're very advanced, don't have surgical options. But in situations like this, where the tumor is limited to the surface of the peritoneum, surgery can be a very important component. Now, unfortunately, surgery alone is not going to get every last little cell of tumor out of the belly. And so applying chemotherapy into the belly at the time of surgery is the treatment that Mr. Habash received. Now, before we go into the treatment, can you tell us a little bit about what the doctors told you about treatment options? What were your expected outcomes with chemo alone? Did they make the mistake of telling you how long you were going to live or anything like that?
I have hope and I have belief that if my time is going to come, it's going to come. But thanks to you, you gave me hope. You did a great job. You never told me like I'm going to die, but you told my wife that that disease that I have, probably I have it from about 7-8 years ago. And then something happened, and like maybe because of death in the family, my immune system went down, the disease started taking over. But she told me that, in an operation like that, then you told me later that I might have about maybe, if it get worse, there is a better treatment to it, and maybe 10-15 years from now or something. So, you know, I feel very optimistic about being alive and, you know, like seeing you, seeing everybody, wake up in the morning,